Hi, I'm Dr. David Klein with Stages of Life Medical Institute. Thank you for tuning in. We're going to have a little discussion here about something that has been bandied about a lot, and that's autoimmune disorders and increased susceptibility to infection. And that's absolutely correct. But not all autoimmune disorders are the same. Not all patients are the same, and not all risks are the same. So if we're going to look at Italy, which is a good example of how not to do things, who is it? Why is it? And why would COVID-19 pick on old people? And the answer is they're more likely to end up with chronic disease states. So in retrospect, who bought the farm? Who died from this? And they were individuals over a certain age, like me, which is 65, with 3 chronic illnesses. And one of those chronic illnesses might be diabetes, it might be hypertension, it might be cardiovascular disease, or it might be lupus, rheumatoid arthritis, ankylosing spondylitis, or things like plaque psoriasis. These are the sorts of disorders that are already manifesting due to compromised immune system. So who out there do you think is under greater risk right now? Somebody like me who takes a thyroid tablet, or somebody out there that's taking a $10,000 a month biologic to treat plaque psoriasis? So if you're taking something, short version, if you're taking something that's advertised on TV right now, which generally means it's an expensive medication, for things like plaque psoriasis, rheumatoid, ankylosing spondylitis, Crohn's disease, you are taking something that is going to decrease your body's ability to fight infection. You need to stay home. You need to isolate yourself, and you need to make sure that nobody brings COVID-19 to you, because you are actually at increased risk. Now, this is kind of an interesting thought, and I'm going to pitch it out there because I want you to remember this. So right now, you're taking Plaquenil. You're taking this because you have an autoimmune disorder. You're taking something like Plaquenil. Is this necessarily going to make you at increased risk or decreased risk? My suspicion is individuals that are already taking Plaquenil for autoimmune disorders are likely to be resistant to the bug, the same way as the same medication being taken in Africa for malaria prophylaxis, same thing, that they're going to be at decreased risk. So what I'd like you to do is to keep track of the Plaquenil. You need to be taking it. Unfortunately, much of it has been diverted to New York, where things have become a little bit more critical than they are in the flyover states, such as every place but New York and California. So it's going to get harder to find. I did find a source of Plaquenil that's going to open up in April. So if you need Plaquenil and it's still a problem by Easter, I should be able to get it for you. How are we going to do this? I'm working with a compounding pharmacy that's able to put this together. The technique to do this is simple enough. We have to establish a telehealth visit. You have to be a patient, and then I can write a prescription on your behalf. Should that happen, you can call us at 407-679-3337, or you can check us on net, which is suffernomore.com, and work your way around that to get to us. But we can do it, so we have options. Thank you. This is Dr. David Klein, Stages of Life Medical Institute.